The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Health is a state of complete harmony of the body, mind, and spirit. A very good evening to all our viewers and welcome to another episode of BMC Global Live Hilal Health World. Nothing but lifestyle. Myself as your host, Ganga Jain. Today we are delighted to have you here with us, Dr. Maimoona Liaqat. She works as a laparoscopy gynecologist at Al Hilal Morocco branch. And today we're going to discuss about abnormal uterine disease and PCOD, Polycystic Ovarian Disease. Thank you for joining us on the show and welcome to the show.
Thank you for having me, Ganga. Delighted. And yes, let's discuss about our issues.
Yes. What is abnormal uterine disease?
So you see, abnormal uterine bleeding is something which is anything which is not normal, as the name tells. We usually have a normal pattern of bleeding or your menstrual cycle. So whenever it's too long or it's too short or there's some issue with it, that is called abnormal uterine bleeding. Again, remember that the name is misguiding. It's not just uterine bleeding. Even though the bleeding is coming from there, there are other things. We have ovaries inside, we have tubes inside, and we also have the cervix. So any part of the whole female genital system can cause that abnormal uterine bleeding.
How common is this disease?
So it's said that every woman in their whole lifetime are going to be visiting a hospital, 30%. So you have a chance that 30% you may end up in the hospital because of this problem. So you can understand that how common it is. It is really important to focus on it.
So what are the common signs and symptoms of this disease?
So you see, when we say that a patient is presenting with a problem of abnormal uterine bleeding, they may be experiencing period issue, which may be like before period spotting, after period spotting. They may be having some bleeding between the two cycles. They may be having some discharge which is coming along with the periods for a long time. They may have any other pain along with the periods or the bleeding. So it presents in different ways. Some patients come in, they don't have bleeding issue, but they have the abdominal pain, lower abdominal pain. They have discharge, they have itching. So they can present with anything along with bleeding, or sometimes they come for other issues, but when you check them, they turn out to have the issue of abnormal bleeding.
Okay, so how can we prevent this disease?
Okay, so preventing means that taking care of your health earlier.
Yeah.
Suppose you're experiencing some problem, you don't need to sit at home.
Yeah.
Try to visit your doctor ASAP, as soon as possible. Instead of thinking that, I think it's normal, in our countries or in our, usually people have the myth or the concept that it is okay for young girls to have some bleeding coming on and off, and that's fine. And sometimes even during pregnancy or, mothers and they're scared to take you to the hospital. They say, no, if you go there, maybe they're I don't know, some monster will be, what do you say? Diagnosed.
Yeah.
So what I suggest is that as soon as your girls are start puberty, you educate them, you tell them what is period, you tell them how they will handle it. In case if they start having problems, they may go through heavy bleeding. It's better to at least bring them, be reassured. We don't need to give treatment, but we just need to be sure that she's not having any problem. Secondly, that a healthy lifestyle is going to keep you healthy. Healthy means good regular exercise, 30 minutes a day. That may be a walk, anything which is going to increase your heartbeat. And then healthy food. So you can see all the people here, what do we eat? You can actually understand that our lifestyle is mostly, we all have moved to a junk food era. So pizzas, pastas, and also not very healthy ones, like if we eat more of broccoli pasta, no, we need cheese pasta full of cheese, or burgers full of double cheese. So try to avoid such food. Try to eat healthy. I mean, smoothies are very good. Green smoothies, mixed vegetable, juices, they're very good. You can try to improve yourself. Going to organic food is very good, because the food we find in the market, they're all usually hormone related. The chicken we find so fast, they're given hormones. So they grow very fast, and we end up with the chicken. Try to avoid all the foods, go to organic side, try to get healthy sleep, avoid stress. It's not in our hands, but at least we can try to be happy. We can try. The social media these days, it has overtaken our kids. We can see everyone, 5 people sitting in a room, holding the cameras, mobiles, everything. Everyone's on laptop. These things create issues. We are not openly, discussing things. We are into stress. We are not moving around much. We are gaining weight. So if we can prevent all these things, we become active, we become happy. These are the things which will help us lead a healthy life and not have hormonal issues and not end up with polyps or any, abnormal problems in our general female problems as well.
Yeah, so the main thing is that we have to maintain a healthy lifestyle.
Yeah.
Okay, so is this disease very serious?
See, abnormal uterine bleeding depends on what is the cause.
Yeah.
So if a young girl is coming in and she's just having hormonal issue, or if she's having just a small polyp sitting there, that's not very worrying. Polyps, fibroids, and certain infections, they're not worrying. But if they're continuously there and they keep on, they're not treated properly, they can become serious. So we have to investigate what is the reason and try to, treat the reason.
Yeah. So what's the final treatment for this disease?
As I said, according to different age groups, you have to know when is the patient presenting.
Yeah.
A young girl, prepubertal, she's coming to you and she's having some problem. You're going to be looking for any abnormal foreign body sitting inside, or some trauma or anything, and treat accordingly. A puberty patient who just entered adolescence and she's going into puberty, she's more likely to have problem with her hormones. So you'll be treating her, or you will support her, reassure them, and tell them how to handle that. Suppose if a patient who's trying to conceive, or in a normal life comes in, you're looking for the causes of bleeding. So the common causes would be polyps, fibroids, ovarian cysts, polycystic ovaries, hormone imbalance, and then you go for the problems which are like endometrial cancers or cervical cancer or some advanced things. So all these common things can be dealt with according to whatever the treatment is.
Okay, so now we're going to talk about the polycystic ovarian disease.
Yeah.
PCOD. Yeah.
Just before that, if you don't mind, I wanted to tell girls something.
Yeah.
There's a certain thing called ovulation bleeding. Okay, some patients don't know that. What happens is when you have a period, during the period, on the day around ovulation, some patients can get a withdrawal bleed, a little bit bleeding. For some, it may be heavy for 1-2 days. The reason is the sudden withdrawal of the hormones, because the hormones in the body, when the egg opens, it ruptures, the hormones suddenly fall down, and because of the change, you may have a little bleeding. So that is normal. That is nothing to worry about. Just seen on the ultrasound. So if someone's right on your ultrasound PCO, this does not mean that that patient has a problem and she needs to be treated. It may be just an incidental finding. PCOD means Polycystic Ovarian Disease. So when you say polycystic ovarian disease, that means that person is definitely affected and he's experiencing problem. It's not just related to your ovaries, it is also giving you symptoms, it is also having your hormonal issues, so you need to treat that patient. Whereas the PCOS is polycystic ovarian syndrome. So when the syndrome comes in, syndrome is not only related to your PCOD, like just the disease itself. It has metabolic, so that means related to all your metabolism. You may have diabetes with that. You may be very obese with that. You may experience cardiac issue with that. You may experience sleep apnea. That means when you sleep, you cannot breathe properly. So you are having multiple issues related to that disease itself. And that is more serious.
Yeah, as the name suggests, syndromes, right?
Yeah.
A chain of symptoms.
Yeah.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
what is the reason of PCOD?
So you see, PCOD does not have a clear reason, up till now not diagnosed, but we do know that it has some genetic predisposition. It has some familial tendency, so if your mother or your sister has it, then you're more prone to get it. Then thirdly, we know that the patient with PCO have certain things which are not present in a normal person. For example, a PCO patient may have high insulin resistance. They may make more of a male hormone, which is testosterone, which is going to stop your ovulation and not let you ovulate and make your periods irregular as well. Mostly patients with PCOS are obese as well, but it's not 100% that they have to be obese. Even thin lean patient from 50 to 70% may have high insulin resistance as well.
Okay. So what is the common symptom, or like the common symptoms?
Yeah. So the patient with PCOS, they present in different ways. Some of them come in just because of their irregular cycles. They don't have bleeding for 2 months, 3 months, 6 months even.
Yeah.
Some of patients, they come in with irregular bleeding. They're having sometimes bleeding coming very heavy, then no bleeding for 2 months. Then again, when they have bleeding, it's too heavy. This is because of the hormonal imbalance. Their lining of the uterus, it gets thickened, very thickened. So when they bleed very heavy. Again, these patients can present with hair problem, no problem with periods, but they have extra hair or acne issue, hair fall. Sometimes they have some body spots, the blackish spots coming on the body. Some patients present with obesity. We're gaining weight. We don't know. We are doing everything, trying to lose. It's not coming down. And some of them may present even with infertility. So most commonly, these patients have different issues. Some of them have mostly period problem for which they come in, or they're referred by the skin, by the dermatologist for the acne or hair, to go further in investigation of their hormones, whether they have some issue.
Okay. So what are the treatment alternatives for the patients with this disease and are planning to get pregnant?
Okay. So now when a patient comes in, first thing is we have to diagnose them.
Yeah.
We need some blood test for them. We have to know how to find out they have PCO or not. So obviously every patient who walks in, a proper good history matters. And there's one thing I really want people to know, that PCO is not a joke. Please don't tell everyone PCO and leave them alone. The very important thing, Ganga, I've noticed here in Bahrain is that unfortunately patients are walking in your clinic diagnosed as PCO for ages. Like maybe they know that we are PCO from 3 years, 4 years, but they have not taken their treatment properly. And they do not know how to actually control their PCOS. Because PCOS is something, if you properly take care, it's going to stay down. The moment you don't take your treatment properly, it's going to come back.
Yeah.
What happens is they're taking medication, they take it for 1 month, 2 months, and they think they're okay, and they leave it, and it comes back. So the issues never resolve. It is so important for the patient to understand what she's having, and then to try to treat it for long term, not just for the few months. In general, you need to understand that if a patient has high insulin resistance, then you need to give them glucophage and dietary improvement. So unless if a patient's weight or BMI is more than 30, you must make sure, tell them to bring their BMI below that. Anyone above 35 is very high. They are not going to ovulate unless they reduce their weight. And the interesting thing is, they only have to lose 15 to 20% of their body weight. Whatever their baseline is, the moment they reduce 15 to 20%, their body starts, coming back. They start ovulating. They start making eggs. So if you're trying to get pregnant, you don't need to come to doctor, lose your weight. If you're obese and you have insulin issue. Now, here comes a part, a lot of patients are coming, they're eating glucophage because people thought they have PCO. When we do the test, when we do the fasting insulin, the insulin is normal. That glucophage is not going to help them. That's only going to make them more sick.
Okay.
So you have to know whether the patient with PCO, does that patient have insulin issue or not? You do the test first and then tell them that Is their weight going to come down when they're going to take glucophage for the high insulin? Yes. But if insulin is normal, you're taking glucophage, it's not going to help you at all. And then coming to period issue, with this, we can put them on some hormones. We can put them on cyclical oral contraceptive pills.
Yeah.
In young girls who have hair problem, we can give them Dian 35. But then again, Dian 35 is not going to help you in 3 months, 6 months. You have to take it more than 9 months to 1 year to make your extra hair go away. When you'll take it just 3 months and then leave it, hair is not going to go.
Like
New hair
masculine features.
Yes. They are only controlled if you take it for 9 months and onwards. Then new hair will stop. But we cannot do magic. You do need the,
it takes time,
laser
right?
and everything. Yeah. You have to go to the hospital for laser treatments and continue your medication, and after 9 months you get better.
Okay, so what is the best possible treatment for this disease?
So you see, if a patient is coming to me and she's saying that, doctor, I just want my periods regular, then I have to treat her according to that. I'm going to see her weight. She's obese. I'll tell her to cut down on the weight. If her insulin is high, I'm going to put her on glucophage. If she needs hormonal, management, I'll put her on that. But I will guide her how long this is going to take and when should she be back and how she should control. If a patient is coming, she says, I have no issue with my period. Even if they don't come for 3-4 months, I don't mind. I don't need to give her OCPs. All I need to do is keep an eye on her. After every 3 months, she should have bleeding once. Because after 3 months, then your lining gets very thick. So every 3 months, I would like her to come, take medicine, get withdrawal bleed, and just focus on her lifestyle.
Okay, so with proper treatment, we can cure this disease, right?
Yeah, definitely. And the last thing was, because you said about pregnancy.
Yeah.
Patients who are trying to get pregnant, definitely we need to support them more. For them, losing weight, glucophage, and there are some medicines to make the eggs. So there's a clomiphene citrate, everyone knows about it by the name of Clomid, and that is used to make new eggs. There are some other things in the market as well, which can be given if they're trying to get pregnant. Okay, so again, you're looking for pregnancy only. Whether you don't have any other issue, I would suggest that please, before coming to us, focus on your weight, is it high or not, and then if they have diabetes along with PCO, we need to get that controlled. So dietary, there's a thing called inositol, which helps for PCOS patient. It's a dietary supplement.
Okay.
And inositol and magnesium, they are very good for patients who are actually trying to conceive. These are some supplements which help them.
Okay. So, does this make a woman sterile, this disease?
It's not sterile. Definitely these women, it's difficult. It's a challenge for them to get pregnant.
Okay.
And once they get pregnant, they have a lot of complications. They're more high risk for having complications. But they don't become sterile because of that. You just need to bring them back into their place. Their hormone need to be back. So they start ovulating. They're just not ovulating. They're basically having these tiny small eggs. These are cysts. They don't grow. So that's why we need those cysts or those eggs to grow to make a baby. If you don't have an egg, you can't get pregnant. So PCO is same, Polycystic Ovarian Disease. So they're small tiny eggs which we call cysts. That's why it's PCO.
Okay. So before we wind up, is there any final advice for our viewers to prevent these diseases?
So I have already mentioned a lot about your lifestyle. I want you guys to be healthy. Stay safe in this busy world of the social media overtake. Please try to give yourself time, take care of your health. If you're experiencing any problem with you, with your daughter, with your sisters, tell them not to sit home. Please visit early, because you don't want the water to go above your head and then things get more complicated. Walk, eat healthy, stress-free, stop smoking in shisha, and yes, enjoy your life and visit the doctor. Thank you.
So thank you for answering all our queries. And stay tuned on every Tuesday at 8 p.m. on BMC Global Live Al Hilal Health World. And until then, this is Ganga Jain signing off. Thank you.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable